Okay, Samir, he's thrown down the gauntlet. You've got 5 minutes for rebuttal.
So, I don't know, the picture about the garbage, all data were garbage because there is, just to highlight the Cleveland Clinic data to say that TAVR versus SAVR, there's of course no comparison, right? We do the TAVRs when SAVRs are not possible. And to compare the data, it looks still better. And all the patients are high-risk patients, and virtually there's not a single patient that we refuse that they can do SAVR. So there is a very difficult group to compare, one area, because that data I at least know. The second, to compare this Medicare data and say that now at 1 year, 2 years is crossing, not seen in any of the randomized trials. And randomized trials, I understand that, if you say that you don't need to do randomized trials, then we stop it. But randomized trials are applicable because they are properly done. So to say that the randomized trial cherry-picked the patient, we are cherry-picking the patient. I'm not saying that do TAVR in all patients, but if the patient is a good patient who has a good anatomy, what is the point if we have the same patient? That is plenty of them. So there are plenty of patients that are coming to us who are very good anatomy, and then and when we started TAVR, the same question came that you are not removing the valve, something bad is going to happen. But nothing bad is happening. So we have, in now 20 years, 90,000 people are undergoing TAVR. So I think whatever way you look at it, it is very, very hard. I just want to ask you, if some of you are 65, I would say that if you have aortic stenosis and your valve anatomy is perfect, do you really want surgery? Many patients come to me if they're proximal LAD lesion, cardiac surgeons included. They would say, Samir, please put a stent. Put it in the night, put it in the day, morning, when nobody's around so nobody knows I had a stent. But they do not want surgery. Who wants a lima? If you read stenosis, 2% mortality difference at 10 years, nobody cares. So I'm just saying that this is a very tough sell. Even if you want to sell it, it's difficult. I don't mind it. I tell patients, if you want to have surgery, please have surgery. They say, please, I do not want to have surgery. What's wrong with you? So this is the common question. So I just want to know that let's say you are going to be 65 and you want to, you say that now you're healthy and you want to have surgery or you want to have no surgery. This is the question. Outcomes are the same. What would you do? How many want surgery, open surgery? I just am curious because I'm getting there. So I don't want to, I'm curious to know how many, if you saw randomized data, your anatomy is good. I'm not saying that I'm doing a trash, but how many would want an open surgery? I'm just curious. Oh, surgeons want it. Yeah, that's fair. But I'm telling you, the surgeons do not want surgery, but I'm glad that at least you are raising your hand right now. But I have more surgeon patients than cardiologists. And then how many do not want to have open surgery? By God, I really don't. But, right, huh? That's the perception, but I don't know what to say. But I don't mind it, if you say, I'm not selling TAVR. On the contrary, I'm not selling, but I don't need to sell it. I'm just saying, please don't do TAVR. People are knocking. So this is what I'm saying, that this is what is happening in real life. Okay, thank you.